Hey y'all, welcome back to the Rebel Fam. I am Callie, and today is day 3 of National Infertility Awareness Week, and I've been participating in the photo challenge for it, except I'm doing a little different take. I'm doing a video on it every single day. So yesterday was Fur Baby Day, and we did an adoption story on our fur baby. Today is Wear Orange. I don't have a lot of orange, so this is my orange. You'd think with being in autumn I'd wear more orange, but I don't. So anyways, here we are, day 3. So today's, like I said, Wear Orange, and today I kind of wanted to talk about infertility, different causes of it, and a couple of statistics that I've shared in every single video for Infertility Awareness Week so far. So let's just get it started. 1 in 8 women struggle with infertility. And the older you get, the higher your chances of infertility are. So once you hit 30, it's rapidly declining from there. That is information that I have learned from a few different sources, but right now I am on the CDC website, and the reason I'm on the website is I already know this stuff, but I want to make sure that I'm getting my facts straight, because facts are good. So 1 in 8 women struggle with infertility. And once you hit 35, infertility is defined as not getting pregnant within 6 months. Before 35, it is defined as not getting pregnant within a year. So, Ash and I have officially receiving a diagnosis from our OBGYN of infertility. Now, the cause of our specific infertility is unknown right now, because there are still more tests that need to be done, that we're waiting for all of this COVID-19 stuff to blow over before we are going to a hospital to get those tests done. So, I'm, like I said, I'm on the CDC website, which is what I'm looking at right here. So 1 in 4 women have had a miscarriage. That is a significant amount of women. As I said before, it's time to flip that script. It is time to talk about it. Because part of this struggle is feeling like you're alone, and you're not. So, the 1 in 8 is roughly 12% of women struggle with infertility, which is getting pregnant or carrying a pregnancy to term. Yeah. as they're saying, you can go to the CDC website as well, and it says a whole bunch of stuff on infertility. And it's not always the woman's fault. About 35, according to the CDC website, 35% of couples with infertility, a male factor is identified along with a female couple, or female factor. So in the couple, 35% is actually the male and the female. In about 8% of couples with infertility, a male factor is the only identifiable cause. And almost 9% of men aged 25 to 44 in the United States reported that they or their partner saw a doctor for advice, testing, or treatment for infertility during their lifetime. It lists different causes of or reasons a man could be infertile. For my husband, unfortunately, he grew up in Flint, so we know that some of their water can cause a man to become sterile. Thankfully, he was not drinking the water, so we still have some hope for that. So yeah, they list it's hormonal disorders, genetic disorders, stuff like that can cause infertility in men. And in women, we know that there are lots of things that can go on. There are blockages in the tubes that can go on, which is a test that I have to undergo to see if that's the case with us. There is PCOS, endometriosis, adenomyosis, irregular cycles, bicornuate uterus, I already said PCOS, what's called a diminished ovarian reserve. There are so many different reasons for infertility. So many different reasons for infertility. Like I said, go onto the CDC website. They have more information. I'm scrolling and I'm saying what is jumping out at me. So a huge thing that increases risk of infertility is age. And with my husband and I being 27, we're creeping up on 30. It is something that definitely is on our minds as we're trying to get pregnant. Now, this is a huge one I wanted to talk about because I feel like we waited too long to go see an OBGYN. Know your body is a huge part of this. Knowing your body is massive in this. If you're under 35, a lot of people suggest waiting a year to seek help with fertility. They say some health problems that increase risk of infertility would make it a good idea for you to see your doctor sooner. This is, and I'm going to list some reasons, or I'm going to read some reasons. They say that if you have these issues, that you should go see your doctor sooner. Irregular periods or no menstrual periods. Now, this is why I feel like we waited too long to go to the doctor about this, because my periods have always been irregular. So I feel like if we maybe got more of a handle on my periods and my cycle before, you might not have had as many issues. Very painful periods. Yep. Endometriosis, pelvic inflammatory disease, more than one miscarriage, or suspected male factor. Now, out of those 6 listed, 3. I have 3. So I feel like if I had known what I know now about infertility, I probably would have gone quite a bit sooner. I also did not know that irregular periods and not having your cycle for an extended amount of time can increase your risk of it's either ovarian cancer or cervical cancer. And I did not know that until like 2 months ago. So like I said, if I had known right when we got married the things that I know now, I don't think we would have been waiting so long to try and figure the things that we're trying to figure out. I don't think we would have waited as long. And that's part of why I want to help raise awareness about this, is because so many people are uninformed about infertility and the different causes and the different treatments, because what I know is just scratching the surface of what there is to know. And I'm constantly trying to research, trying to learn more, and I definitely think that people need to be more educated and informed on this, especially if you are struggling with infertility. One thing that has helped me is joining a support group on Facebook for women that are TTC with endometriosis, PCOS, and other different things that can affect fertility. And that has been very educational for me. I can go and ask a lot of questions that women are able to answer for me. So that is really nice for me to have that resource. But a huge thing, you are not alone. Can I repeat that? You are not alone in this struggle, in this fight, in this pain. You're not alone. And that is a huge thing to remember. So, we will be back tomorrow for day 4 of National Infertility Awareness Week. I hope you guys have a great day, and we'll see you later. As always, don't forget to subscribe. Click on the notification bell so you're notified every time we post a video. We try to post a video every week. Don't forget to click the thumbs up, give it a like, and comment where you can.